Bladder 16, governing Shu. Location, bladder 16 is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the sixth thoracic vertebra, T6. How to find? First, locate the spinous process of C7. From there, count down 6 spinous processes to the lower border of the spinous process of T6. Measure 1.5 tune lateral to locate bladder 16 on the highest point of the paraspinal musculature, or with the patient standing and their arms hanging down, the spinous process of T7 is level with the inferior angle of the scapula. The next spinous process in the superior direction belongs to T6. Locate bladder 16, 1.5 tune lateral to the midline. Located on the same level are Do10 on the midline, a point of EXB 2.5 tune lateral to the midline, and bladder 45 3 tune lateral to the midline. Needling, bladder 16, 0.5 to 1 tune obliquely towards the spine or transversely subcutaneously. Position is pneumothorax. For the actions and indication, it unbinds the chest, regulates the chi movement in the thorax and abdomen. For the special features, bladder 16, despite its designation as Back-Shu point of the Dumai, this point is hardly mentioned in classical or modern texts. Bladder 16 is used mostly for stasis of blood of the heart, causing heart and chest pain. For the summary, bladder 16 regulates the heart for heart pain. It also moves chi and invigorates blood for those having epigastric pain, abdominal distension, breast abscess. Although conventionally categorized as the Back-Shu point of the governing vessel, it is interesting to note that bladder 16 was not discussed at all in such texts as the systematic classic of acupuncture and moxibustion, the illustrated classics of acupuncture points on the Brunsman or elucidation of the 14 channels. This downplaying of bladder 16 is reflected in other classics by the absence of any clear indication of disorders of the governing vessel, and the general paucity of indications and classical combination of this point as a whole. Its modern use is in the treatment of various skin disorders, including psoriasis, alopecia, and generalized pruritus. Here on the bladder meridian is the governing correspondence point. Domai itself runs between the parallel meridians of the bladder, and this point echoes the resonance of Dumai. Dumai is associated with Yang and Qi in particular. The strength of Dumai is to support us, help us be present, stay upright, and assert ourselves in the world. Larry and Ru Chat described Taiyang, bladder, and small intestine as the greatest expansion of Yang and the principal hair of Dumai. Bladder 16 is a helpful point when there is symptomatology, which indicates that the Dumai governing vessel, or to use an addition to Dumai points. When someone has become downtrodden in spirit, lost their sparkle and ability to shrug off the trials of life, this point can strengthen their resolve and enhance their opportunity to live their life fully, rather than a shrunken, shriveled version. High boost, its alternate name, indicates its rousing qualities. Masosha, 1989, states that it regulates the heart and invigorates the blood. Located just below the Back-Shu point of the heart, the invigorating effect of Dushu affects the area of the heart, moving stasis and thus expanding and relaxing the chest when there is pain. Benefits the diaphragm. Able to affect the heart area in this way, and given the intimate relationship of the heart with blood, it can be used to invigorate or clear heat from the blood. Hence, its use when there is skin diseases with their blood deficiency aspect, itching, or heat in the blood boils. Regulates the qi in the chest and abdomen. It will affect the opposite region on the front of the body, and so can be used for stagnation, pain, deficiency in the upper epigastric area. Can bring an inner strength to a person when struggling with life's trial and tribulations.